This is Sister Virgie Hickman. I am a 13-year breast cancer survivor, and I will be covering some basic information on breast cancer. Each year in the United States, about 240,000 breast cancer cases are diagnosed in women and about 2,100 in men. About 42,000 women and 500 men in the U.S. die each year from breast cancer. Black women have a higher death rate from breast cancer than any other women. 1 in 8 women will develop breast cancer. Every 2 minutes, a woman is diagnosed with breast cancer. Every 13 minutes, a woman dies. Exercise, maintaining a normal weight, obtaining mammograms, and healthy eating. Risk factors include getting older, genetics, overeating, alcohol consumption. Breast density is another issue. Black women frequently have higher incidence of breast density than other women. The onset of menstrual periods, radiation to the chest, as well as close family members who have the BRCA1 or BRCA2 genetic mutation. Hormonal therapy, chemotherapy, as well as surgery. In the U.S., Black women are younger at diagnosis on average, more likely to be diagnosed with an aggressive or advanced form of breast cancer. Black women are also more likely to die from breast cancer than women of any other racial and ethnic group. Survival has improved, but Black women still experience 42% higher death rates than compared to their white counterpart. Inequalities are believed to also play a role, such as income, diet, reduced access of care, as well as the tumor biology itself. Also, there's delays in diagnosis. The National Institute of Health is working to reduce some of these inequalities. Remember, early detection and treatment is the key. A woman with average risk is recommended to start their mammograms between 50 to 74 years old, and they should expect to get them every 2 years. High-risk women are women who have their parents, siblings, or children who've had breast cancer, or if there's anybody in their family who is a male who had breast cancer, they are suggesting that they start their screenings around their 40s. At any rate, please speak to your provider concerning this. Another thing is to know your breasts. And I personally found my own tumor. Know how your breasts feel.
Hey, I want all my brothers, all my men to come in a little closer. A little closer. There you go. I have something to share with you about breast cancer in men. Although it is rare, men can get breast cancer. I want you to learn about the symptoms of breast cancer in men and things that may increase your risk. Breast cancer is most often found in women, but men can get breast cancer too. As a matter of fact, about 1 out of every 100 breast cancers diagnosed in the United States is found in a man. The most common kinds of breast cancers in men are invasive ductal carcinoma. The cancer cells begin in the ducts and then grow outside the ducts into other parts of the breast tissues. Invasive cancer cells can also spread or metastasize to other parts of the body. Another kind is ductal carcinoma, is a breast disease that may lead to invasive breast cancer. The cancer cells are only in the lining of the ducts and have not spread to other tissues in the breast. What are some of the symptoms? I'm glad you asked. The most common symptoms of breast cancer in men are a lump or swelling in the breast, redness or flaky skin in the breast, irritation or dimpling of breast skin, nipple discharge, and pulling in of the nipple or pain in the nipple area. These symptoms can happen with other conditions that are not cancer. If you have any symptoms or changes, please see your doctor right away. Thank you, brothers. I appreciate your attention.
Breast cancer statistics by age. Though breast cancer in the United States occurs primarily in middle-aged and older women, it does not discriminate. About 9% of all new breast cancer cases in the U.S. are diagnosed in women younger than 45 years old. Now, let's talk survivorship. Breast cancer, when caught in its earliest localized stages, increases the 5-year survival rate to about 99%. Advances in early detection and treatment methods have significantly increased breast cancer survival rates in the recent years, and there are currently over 3.8 million breast cancer survivors in the U.S., some of which are in our midst today. With preventative measures, early detection, and continued research, the future is bright.